Everyone. I hope you're doing well whenever you are. Thank you so much for joining me to this session. I'm really excited to share some of the projects that we've been working on, and would appreciate any inputs or discussions from each of you. Today, I'll be talking about ways to model the impact of non-pharmaceutical interventions during the COVID-19 pandemic. So before we get started, let me give you a bit of background about myself so you know where I'm coming from. I completed my PhD in applied math and statistics at Stony Brook University in 2022. And since then, I've been working as a biostatistician at Moderna. My research focused on public health challenges related to infectious disease, with expertise in statistical modeling, machine learning, and epidemiological surveillance. A quick disclaimer before we dive into the details. The contents of this talk is based on my research before joining Moderna, so it's not intended to represent the official policy or the position or the opinions of Moderna. Now, without further ado, let's move forward and explore the impact of non-pharmaceutical interventions during the COVID-19 pandemic. If we think back to the very beginning of the pandemic, you might still remember the phrase flatten the curve. So this is being to say we want to slow the transmission enough so that it won't overwhelm the healthcare system capacity. By slowing down the transmission, hospitals and other medical resources wouldn't get exhausted all at once. And also, since vaccines are not available at the early stage, governments had to rely on non-pharmaceutical interventions to slow down the spread, so that we can give healthcare systems the breathing room that they needed. So what exactly are NPIs? NPIs are actions implemented to slow down the spread of infectious disease without relying on any pharmaceutical treatments. So they're typically put in place early in an outbreak to protect the healthcare system, especially when vaccines or treatments are not available yet. So here are some examples of NPI. Regular hand washing and wearing masks. This focus on the population behavioral change. And adding physical barriers is an instance of environmental adjustments. There are also like official policies like social distancing, gathering restrictions, business closure, and stay-at-home order. Okay, so at this point, we are now familiar with the concept of NPIs, but here's the challenge. Each of the interventions can come with significant economic and social costs. So we need to find the right balance between controlling the spread of the virus and minimizing the disruptions to daily life and economy. Also, having solid data will allow policymakers to make informed and smart decisions based on evidence rather than the guesswork. And most importantly, the insights we gain now will help us to better prepare for future pandemics. Now that we have addressed the why, let's move on to explore the challenges of tackling the how. Here we listed several key challenges. First, inconsistent application of NPIs across regions. Different states, regions, and even cities will have different levels of restrictions, timelines, and enforcement. And this made it really hard to measure how effective these interventions were because the outcomes were so dependent on how and when they were applied. Second, some of NPIs might work well in certain area, but it is hard to conclude if it works equally well in the region of interest. And finally, and perhaps most importantly, there was an urgent need for evidence-based assessment to guide the public health policies. Especially in the early days of the pandemic, policymakers have to make quick decisions with very limited information. Next, we will walk through the key gaps in the previous research on NPI effectiveness. So first, a lot of studies were focused on Europe. So while this will give us valuable insights, but they didn't actually capture the full picture in other regions, especially in the United States, where the situation and the response were quite different. Another issue is the time period that these studies covered. Most of them look only at the data before April 2020, which means that they miss out analyzing NPIs that were introduced later in the pandemic. Now, looking at the United States, a major challenge was the lack of recovery data. And without that information, popular models, for example, the SEIR models, were not feasible to use. And for the limited number of studies, that conducted based on the United States, most of them only reflect the joint effectiveness of the implemented NPI portfolios, but provide very little knowledge to the individual effectiveness of each NPI. And finally, face mask mandates were one of the area that haven't been studied quantitatively in much detail. While we saw extensive use of the face mask, there wasn't enough research to tell us just how effective these mandates were at reducing the transmission. So to address the gaps in the previous research, we conducted a study using the 3 different Bayesian hierarchical models. Each of these models help us evaluate the effectiveness of NPIs in a unique way. So first, we have the prototypical model to assess the effectiveness of 5 of the most commonly imposed NPIs. We have the counterfactual model to look at the more controversial NPI, the face mask mandate. Finally, we use the advanced model to get a more comprehensive picture of how these interventions work together to reduce virus transmission. Let's get started by diving into the prototypical model and its analysis. So the prototypical model used an indicator variable to restore the time-varying reproduction number, and the model will calculate backwards from the observed death to estimate the transmission that occurred several weeks ago. The model deaths are informed by the infection to death distribution. And the infection to death distribution consists of 2 parts, the infection to symptom onset distribution and the symptom onset to death distribution. So our study period, we focus on the first wave of the pandemic in the United States. And the study, in terms of setting, we analyzed the data from 42 states where the cumulative death count exceeded 100 by the end of the study period. Here we categorize the states using color coding. The green states are those 42 states that being included in the study, where the gray states are those that didn't exceed that death count didn't exceed 100 by the end of the study period, and we exclude them from the study. And we also study the 5 commonly imposed NPIs. The first one, gathering restriction. This refers to that the state has set a size limit on gatherings. Restaurant capacity restriction. It refers to the states have issued capacity restrictions in restaurants. Business closure, it refers to the states has closed the operations of most face-to-face business unless they are designated as essential business, for example, grocery stores or healthcare facilities. School closure, it refers to the state has closed schools statewide. And the stay-at-home order refers to that the state issue an order for the general public to stay at home. And exemptions usually granted for grocery shopping, going to work, going to a hospital. Data source. The COVID-19 daily case and death data in each state were obtained from the Johns Hopkins University COVID-19 dashboard. And the start date for each NPI in each state were collected manually from the state government announcements and mainstream public medias. And we use 7-day rolling average in analysis to account for the testing and reporting delay during weekends. We implemented the prototypical model on the United States state level data in R. And our analysis shows that school closure is the most significant intervention in reducing the reproduction number. And then it closely followed by stay-at-home order. And the restaurant restrictions, limitations on gathering size and other business closure appears to be less effective according to our analysis. We also restored the reproduction number estimation for all states included in our analysis. So it's basically available for all the 42 states that are being included in the study. Here, let's take New York as an example. This gives us a way to visualize the impact of NPIs, specifically in New York, over the study period. Which allowing the decision makers to see how different measures affected virus transmission. So on the graph, the vertical lines are represent the days when NPIs were implemented, and the dark blue bands refers to the 95% credible interval, and the light blue bands shows the 50% credible interval for the reproduction number. Here you will notice a dramatic drop in the estimated reproduction number right after the school closure were put in effect. Then there's another noticeable decline following by the stay-at-home order. These two NPIs clearly had a significant impact in reducing the spread of virus during this period. The counterfactual model. So this model allows us to answer a really interesting what-if question. What would have happened if two regions had switched their NPI policies from the start of the pandemic? This is where our counterfactual model comes into play. It helps us to explore these hypothetical scenarios. However, the challenge here is that each region has its own unique characteristics. It has its own population behavior, its own healthcare capacity, or even geographical factors. So when we switch the policies between regions, we need to preserve the specific properties of each region while still accurately representing how changes in policy would affect the virus transmission. It's like trying to transpose the impacts of one region's policy onto another while keeping all the important local details intact. Now let's focus on a particularly divisive intervention, the face mask mandate. Face mask policies became a highly political issue during the pandemic. So states with Republican governors were more likely to adopt voluntary mask wearing policies, where states with Democratic governors tends to impose stricter face mask mandates. This division between political parties lead to varying policies across the United States. To the best of our knowledge, this is the first study in the United States that's provide an in-depth evaluation of face mask effectiveness using this methodology. The counterfactual model we use here is quite similar to be applied in the prototypical model. The key difference here is that we use a discrete random walk to capture the changes in transmission over time. This approach allows us to better account for the fluctuations in virus transmission due to policy changes. Now let's take a closer look at the specific context in our analysis of the face mask mandate. The study period is same as before. It focused on the first wave of the pandemic in the United States. And also the settings are the same. It also covers the same 42 states whose death count had exceeded 100 by the end of the study period. Here, the gray states again refers to the states excluded from the analysis due to low death count. And this time, the 14 green states refers to the states that implemented face mask mandate policy during the study period. And the rest 28 states didn't implemented face mask mandate policy during our study period. So here on the left, we have a graph showing states that didn't implement a mask mandate during the study period. The red line here represents the original estimation of infections in those states. And the green dashed line is the counterfactual estimation, showing that what might have happened if these states had implemented a mask mandate from the start. Here, as you can see, initiating a face mask mandate would have likely resulted in a significant reduction in infections. And they're represented by the shaded area around the dashed line. And on the right, we have the states that didn't implement a face mask mandate. It basically has the same idea. So we will skip here in the interest of time. But the takeaway here is very clear. All states that implemented mask mandates had fewer infections. The advanced model. So while the previous two studies cover a large portion of the United States, we still have to exclude about 18% of states from the analysis. Ideally, what we need is a model that can integrate both the face mask mandate and the 5 commonly imposed NPIs. So this would allow us to evaluate the effectiveness of each intervention from a unified perspective, and giving us a more comprehensive understanding of how each measure contributed to controlling the spread of virus. So in the advanced model, we link daily number of contagious subjects and daily number of new infections to the daily number of reported new cases. The study period is same as the prototypical model and the counterfactual model, also the first wave of the pandemic in the United States. But the difference is that this time we include all 50 states and the District of Columbia into the analysis. From our estimation using the advanced model, school closure are found still to be the most significant intervention, followed by the mask mandate, then restaurant restriction, and the stay-at-home order. Business closure and gathering size restrictions are found to be less effective in reducing the number of new infections. Similar as before, we restored the number of new cases over time to allow policymakers looking at each state. Here again is the example of New York. On the plot, R refers to restaurant restriction, S refers to school closure, H refers to stay-at-home order, G is gathering restriction, B is business closure, and M is mask mandate. Here we can see that in New York, restriction on restaurant capacities are not strong enough in reducing the number of infections, because we still see like the number of infections are increasing after the implementation of the intervention. However, we can see that school closure, stay at home, gathering restriction, business closure, and mask mandate are found to be effective in reducing the number of infections in New York. A brief summary by looking at the data from across the United States during the first wave of the COVID-19 pandemic, we found that some NPIs were much more effective than the others. School closure, mask mandate, restaurant restrictions, and stay-at-home orders had a significant impact in slowing the spread of COVID-19. And in contrast, measures like gathering size limits and business closure didn't seem to be effective. So these findings will be very helpful in showing us like which interventions play the biggest role in controlling the virus. With the advanced Bayesian hierarchical model, we were able to include data from all 50 states in the United States and the District of Columbia, which will give us a complete and large-scale view of how effective the NPIs were across the entire country. And our goal with this analysis was to provide insights that could help ease the burden of the public. And by estimating the effectiveness of each individual NPI, we aim to give governments and the information that they need to be stricter on the measures that really work and move away from those that are less effective. And since we are short on time, I couldn't cover everything today. But if you would like to dive deeper into the methodological details or look at the restored time-varying reproduction number for any state, we've got data for all of them. You can just scan the QR code here and check out the full paper and its supplementary materials. All the details are available there if you want to explore further. And if you have more questions that you would like to discuss with me, feel free to email me, and we can set up a time to chat. And I'd like to thank the following individuals for their help and guidance throughout the project. Also, thanks all the audience for your time today. And if you would like to discuss any questions or would like to continue the conversation, you can scan the QR code and we can get connected. I'm always happy to discuss new ideas and hear different perspectives, and I love to connect with you all. I will thank you so much for your time and attention today. It's been a pleasure sharing our work with you, and I really appreciate the opportunity to be part of this discussion. Thank you. Is there any questions? Okay, then I will transfer the session back to the host. Thank you.